This is part 2 of discussing symphysis pubis diastasis and some early techniques that I use for minor cases that are acute and also for chronic cases. There's much more that one wants to do in the rehab of these clients, but for today's purpose we're focusing simply on diastasis and simply on intervention to reduce that. So we're not going to talk about much about the SI joint, integrating the hips, the pelvis, the lumbar spine, muscular stability strengthening, etc., etc. That is all part of a standard intervention for this kind of a problem. But today we're talking about how can we change, how can we improve stability at the symphysis pubis joint. So we talked about my discovery of a posterior glide, pure posterior glide dysfunction, unilateral, and how I treat that with a towel roll under the ischium for 5 minutes to bring it back into anterior glide. That also works for a rotational pattern in the pubic joint. The body knows what to do with a somewhat intelligent force, and that also corrects a rotational force. There is a pattern where the pubic bone is distracted inferiorly on one side, and for that pattern I use forces to bring that left ischium and left pubic bone medially. I basically treat it by taking the client in prone. I take that hip and I adduct it maximally in extension, slight extension, and I maintain that for 2 minutes. I then do the opposite on the other side. After that I test hip rotation, and typically these clients will have reduced internal rotation on the right, reduced external rotation on the left. I restore those, so we're putting forces into the hip joint, which is right here, which impact the ischium, which of course connects to ilium, and of course connects to the pubic bones, and of course connects to the symphysis pubis. A lot of this work is covered in the basic Hesch method workshop, and some of it is contained in the advanced Hesch method, which is a distance learning program. For those who can't attend a seminar, if they're interested, they can also study the basic and intermediate work via a distance learning program. We have limited time here, so I can't spend a tremendous amount of time on each dysfunction. But let's talk now about a pattern in which the fibrocartilage is posterior. In this case, when the fibrocartilage is posterior, you can put the heel of your hand on that fibrocartilage, gently spring it posteriorly, and chances are very good that you will reproduce pain. And I submit that that is a pathomechanical positioning. How do you correct that? You correct it very easily by placing towel rolls, foam rolls under the ischia for 5 minutes. So the force that you're inducing is to get the pubic bones to move anteriorly, and they will also spread laterally with that force, and that fibrocartilage will come back anteriorly. That's the first level of treatment that I would use for anyone that has a mild symphyseal diastasis, would be to use foam rollers under the ischia for 5 minutes. The other treatment that I would use is to then take that foam roller and place it under ischia and the ilium posteriorly. I'm sorry, we just need to ignore that. So I would place the towel rolls on both sides, encompassing the ilium and the ischia, because we want to glide the left and the right hemipelvis anteriorly on the sacrum. So with the client laying down, their weight bearing on the sacrum, and when you put the towel rolls under the ischia and the ilia, you're gliding the ilia and ischia anteriorly. After you accomplish that, a very reasonable thing to do would be then to try and create medial compression on both sides. So you want to bring each pubic bone medially, compress it medially so it really compresses that fibrocartilage, which is how it is designed. And of course, a diastasis is the opposite thereof. So you can have the client lie in side line with the foam roll or firmly rolled towel placed on the anterior pelvis. You can also have them roll so that that towel roll is midpoint between anterolateral and the posterior portion that we treated earlier. And all of these create different angles of compressive force. Another tool that you can use is the use of a sacroiliac support, typically applied in this part of the pelvis. I would drop it down lower where it squeezes the trochanters of the hip, and you can see that it would be straight in line to also create a medial compressive force there. Notice also that when we spoke of placing the towel rolls, foam rolls under the ilium, if you capture it just on and lateral to the PSISs of the ilium, that in fact will induce a lateral force in the back. And what do you get in the front when you do that? You get a medial force at the symphysis pubis. Now it is a little bit more complex than I'm able to cover in this video. We really need to talk about how we treat the sacrum and restore stability of the sacrum in relationship to L5 and with relationship to each ilium. We don't have the time in this video at this time to do so, so we're just limiting our conversation about the symphyseal diastasis. In the advanced body of work, we cover this in much greater detail, and we have a few additional treatment techniques that we discuss in the advanced video. Nonetheless, I think this gives some nice things that you can do for the acute client who has a mild and maybe a moderate symphyseal diastasis. If it's truly severe, those cases are often treated by orthopedists. You read some cases in which there's a severe diastasis and they use the hardware in which you would reduce a pelvic fracture with. You can read those cases in the literature. I want to speak of one article that I just read. It was absolutely a remarkable study. I'm going to also type this up so you'll be able to read this underneath the video after we post it. This article is called, and you won't be able to see it, it's called Symphysis Pubis Distance in Adults, a retrospective CT study, CAT scan. And the authors are from Istanbul, Turkey. And the authors I wouldn't be able to pronounce their names, so I'm not even going to try. This was published in Surgical Radiology Anatomy in 2008. So again, I'll write all those details for chasing down this reference. Wonderful reference. I'm trying to scratch my brain and see if I'm missing anything at this moment, any other additional tips that we have the time to cover. But I think we're going to wrap this up. Again, we were talking about diastasis of the pubic symphysis, and this is my website. We do consults for complex sacroiliac joint and symphyseal joint dysfunction. And here is another bit of information about the seminars. We have a distance learning program, and thank you very much.